Good evening. You are watching AWANI tonight, and I'm Saraya Mia. COVID cases reach record high since the beginning of the pandemic. We deep dive into those numbers and find out what exactly is fueling the spike in cases. That's coming up. The federal government today set up a special task force to make quick decisions for COVID-19 cases in the Greater Klang Valley. This as the country reports 11,079 cases today, the highest ever recorded in Malaysia, with 70% of infections concentrated in Selangor, Kuala Lumpur and Negeri Sembilan. At the same time, the country hit a milestone in administering over 420,000 vaccines yesterday, a daily record high.
We are given the mandate to make quick decisions at the ground level. So when we were visiting these areas together with the State Director, Dato' Yusra Dr. Shari, we identified problems that exist in those areas. So problems that relate to manpower, equipment, bed capacity. We make decisive decisions on procurement, on mobilization of resources, on factors like oxygen, beds, modular ICUs, and other areas. This will immediately help us reduce the stress that is on our healthcare system.
Health Secretary General Dato' Muhammad Shafiq Abdullah, who was also in the news conference, said more medical personnel will be sent to Klang Valley to handle the growing number of new infections. He added the Health Ministry has also asked the Finance Ministry for an additional 1.2 billion ringgit to fight COVID-19. The ministry, he said, has also agreed to increase the wages for the frontliners working in ICUs.
How do we make sense of the record number of COVID cases today, despite the country being in lockdown for over a month? We take a closer look at the numbers with public health specialist Dr. Muhammad Farhan Rusli.
For it to be 11,000, I can guarantee you outside there are probably 50,000 more that we didn't find today. So definitely this is something which is an eye-opener for those who were thinking that the cases were always low. So the cases in our country has never been low, to be honest. It's just that the more testing that you do, the more cases that you find. The more targeted testing you do, the more positive cases from those tests that you will find. So from now, you see the ramping up of the FTTI's program where it's finally being accepted by the Ministry of Health, knowing that, look, we have to find where these cases are, because to wait for it to die off like SARS, like MERS-CoV, like last time, it doesn't work with COVID-19. So you have to find the cases, and the cases will be high before it can ever come down.
Dr. Farhan stressed the importance of transparency when dealing with COVID-19 numbers and the need to differentiate between severe and mild cases.
You have to make the numbers and the data be open for people to see. Out of people who are actually vaccinated, how many of them are actually infected? When did they get infected? Was it in 1 week? Was it after the first dose? Was it after the second dose? Which type of vaccines? Perhaps this gives us a more open knowledge to the people so that when they get vaccines, they know that they might be still susceptible to actually getting COVID. And one of the most important things is to actually reveal, out of these people who actually get vaccinated and get COVID, how many of them actually are severe. Because why is this important? Then it reflects to actually, do we really need to be worried about how many thousand of cases they are? If you tell me that there are 20,000 cases, like I mentioned before last time, and 19,500 of them are actually asymptomatic category 1, should you be worried? And they can all be home quarantined? Definitely not. But it worries me if you have 1,000 new cases, but all these 1,000 are category 3, 4, and 5, that they have severe forms of COVID, then this is a bigger worry. Because 3, 4, and 5 strains the healthcare system. It uses up the ICU beds. It uses up the ventilators. Now, this is our area of concern. It's not about how many people are positive. Because you have to understand that COVID is among us. It's all around us. And don't be surprised that tomorrow you may get COVID. So instead of looking at it in terms as just absolute numbers, you have to look at the granular data so that people may be able to comprehend exactly what they are looking at.
We continue our conversation with Dr. Muhammad Farhan tonight on Consider This. He joins our other guests to deep dive into the 11,000 new cases and if factories and industries are to be blamed for the ineffectual lockdown. Health Director General Tan Sri Dr. Nur Hisham Abdullah said the recent surge in COVID-19 cases in Kuala Lumpur, Selangor and Negeri Sembilan were due to increased and targeted testing. He said enhanced RTK antigen testings were conducted among workers in order to allow factories and workplaces to operate.
Kebanyakan saringan iaitu 52,115 ialah menggunakan RTK antigen di lapangan. Jadi ini menunjukkan majikan contohnya telah menjalankan saringan kepada pekerja-pekerja dan juga dalam komuniti kita tingkatkan saringan. Ini menyumbang kepada peningkatan kes.
Dr. Nur Hisham also explained that even though 85% of infections involving workplaces are less severe in categories 1 and 2, the long period of recovery for patients in categories 3, 4 and 5 have led to overcrowding in hospitals.
Tapi yang menjadikan hospital kita sesak ialah kategori 4 dan 5 memerlukan rawatan yang berpanjangan. Contohnya kategori 4, purata keduduk ataupun purata rawatan di hospital adalah 14 hari. Kategori 5, purata rawatan ialah 21 hari. Jadi walaupun jumlah kes tu tak banyak tetapi pertambahan kes setiap hari menjadikan hospital tu ataupun ICU kita sesak.
The other reason for a surge in cases, he said, was due to the highly infectious Delta variant, which is currently the dominant variant in the country.
2 million doses of COVID-19 vaccines expected to arrive by the end of the month will be distributed in Klang Valley and Negeri Sembilan. According to Prime Minister Tan Sri Muhyiddin Yassin, these vaccines are expected to be used starting August and is aimed at curbing the spread in high-risk areas.
He added that all existing COVID-19 assessment centres will operate daily, with the hiring of additional staff was and still being done by the Health Ministry. Meanwhile, the Prime Minister has approved an allocation of 100 million ringgit for the outsourcing of health services in the Klang Valley. Health Minister Datuk Sri Adam Baba said the funds will also be used to aid in the treatment of non-COVID-19 cases among patients in private hospitals, which have been working closely with the ministry since the pandemic began.
We'll take a short break. Stay with us. Welcome back. COVID-19 has dramatically reshaped the way education is delivered. While technology has helped to mitigate the disruption arising from prolonged closure of schools, the pandemic has exposed gaps in the existing curriculum. We speak to President of AIMSMET Executive Education, Datuk Dr. Giles Yeo, on stopping the education system from regressing further. He said the current system lacks the curriculum to empower future generations of tech-savvy individuals.
To be able for a nation to progress to the future, you must have the people who actually believe and actually follows innovation. So when we talk about innovation capabilities, we have many dimensions about it. Yeah. So we have innovation capability in the areas of teaching, in the areas of institutional innovation, in the areas of marketing innovations, and many other areas. So, but let me go back to education, as you said. Now, we have to go back to the curriculum. All right. So hence, I think not much, although there are efforts in Malaysia over the last 10 years to continue to make changes to the education system. 6 years in the primary school, we inherit the system, and then 2 years in kindergarten, 6 years in the primary school, 5 years in secondary schools, and 1 year or 2 years in pre-universities, and then you go to a 4-year degree program and you progress. That is an education system that we inherited some 60 years ago from the British education system, if you look at it. But by looking at the education system, have we changed that since we get independence? No, we have not.
The education system, he said, should not be confined to a single system or format, but instead be personalized for each student.
Develop that kit in 5 years for this kind of cognitive education, for psychomotor, and then they move on to other parts of knowledge and skill sets in the next 3 years without putting them in box of primary or secondary school. That's something that we must do as a solution.
On the international front, Vietnam is the latest country to announce that it will start mixing COVID-19 vaccines. The government announced today that it will start offering Pfizer-BioNTech's mRNA vaccine as a second dose option for people first inoculated with AstraZeneca. Vietnam's mass inoculation campaign is in its early stages, with less than 300,000 people fully vaccinated. It has so far used the AstraZeneca vaccine and last week took delivery of 97,000 doses of the Pfizer-BioNTech shot. Yesterday, Thailand said it will mix China's Sinovac with the AstraZeneca vaccine in a bid to boost protection against COVID-19. Meanwhile, the World Health Organization advised against the mixing and matching COVID-19 vaccines from different manufacturers. Its chief scientist called it a dangerous trend since there was little data available about the health impact. She said that there are studies going on and there's a need to wait for the results. At the moment, WHO experts said they only have data that it was safe to administer AstraZeneca followed by a Pfizer vaccine as a second dose. Thailand has given the go-ahead for home isolation of COVID patients with mild symptoms and use of home self-test kits. The kingdom is facing a stubborn outbreak that is pushing the country's healthcare and testing capacity to their limits.
Thailand has so far been predominantly using RT-PCR tests, but long queues at testing facilities in Bangkok have caused a rethink of measures to track infections. Its Food and Drug Administration agency said efforts were being made to keep the price of the rapid antigen test kits at around 100 baht or 13 ringgit, which should be available in stores next week. Authorities also approved home and community isolation for asymptomatic or mildly symptomatic COVID cases, as daily infections of more than 9,000 are stretching resources.
At least 66 people died when a massive fire engulfed a COVID isolation ward of an Iraqi hospital. Much of the country's healthcare system is in poor condition after years of conflict. Angry relatives of the victims have been protesting outside the facility.
The fire broke out at the Al Hussein Hospital in the southern city of Nasiriyah late Monday. Cause of the fire is unclear, but reports said it began after an oxygen tank exploded. Iraqi Prime Minister Mustafa al-Kadhimi ordered the arrest of the head of the hospital. This is not the first deadly fire incident involving a hospital this year. In April, an exploding oxygen tank started a blaze that killed at least 82 people at a hospital in the capital Baghdad. Health Minister Hassan al-Tamimi resigned soon after that fire.
In other news, part of a hotel collapsed in the Chinese city of Suzhou, killing 8 people. Rescue workers were searching today for 9 people missing in the ruins. The collapse of part of the CG Kaiwan budget hotel in the coastal city happened yesterday afternoon. Today, rescue workers continue to comb through the rubble in search for survivors. The cause of the collapse was still under investigation. Google has been fined 500 million euros by the French regulators. This is after the tech giant failed to follow an order to thrash out a fair deal with publishers to use their news content on its platform.
France competition authorities said Google failed to negotiate in good faith with media companies over the use of their content under EU copyright rules. In a ruling published on its website, Google must within the next 2 months come up with proposals on how it would compensate news agencies and other publishers for the use of their news. If it does not do that, Google would face additional fines of up to 900,000 euros per day.
That is all we have for you on AWANI tonight. Get the latest news updates on COVID-19 and COVID-19 vaccines from astroawani.com and Astro Awani app. I'm Saraya Mia. We'll see you again.